All right, let's see. Let's see. Is anybody in the waiting room, Christina? Looks to be.
No, I've been letting them in as they
Okay.
come.
It looks to be stabilizing a bit. All right. Let's see. All right, we just broke 20. All right, very good. All right, good afternoon, good morning, everyone. Welcome to the November edition of the CR2C2 seminar series. We've got a couple of internal speakers today. As you all will recall, what we've been doing is this semester, and we'll continue it next semester, is alternate back and forth between the internal projects, internal speakers that are, because again, year two, moving into year three, we've got results. There's a lot of good work that's been done internally through the center to be shared. So that's what we're going to focus on today. We've got two speakers, Dr. Abhay Lidbe from the University of Alabama here with me, and Greg Earhart at the University of Kentucky. And they're going to be talking about some of the work that they've done under our MRI, Major Research Initiative 1, which is integrating emergent technologies into transportation planning and policy for rural communities. So with that, I'm going to turn the floor over to you, Abhay, and good presenting.
Okay. All right. Thank you for that. And do you see my slides? Okay.
Yeah, we can see you. You're good.
All right. So good afternoon, everyone. I am Abhay Lidbe from the University of Alabama. Today, I will be sharing the findings from two complementary research efforts that focuses on strengthening the mobility and transportation access in rural communities across the West Alabama region. Uh, so just to give some high-level statistics and set the stage for this work, we all know that rural America covers about 97% of the US land area. It holds about 68% of the nation's road miles. This makes the transportation essential for rural life, but it also becomes logistically challenging for the individuals without vehicles. So overall, out of about over 2,000 public transit systems in this nation, over half serve rural areas, and still 60% of the rural counties lack public transit altogether. And for those who do trips, those often span between 20 to 30 miles each way. So for rural residents, lack of mobility isn't an inconvenience, but it's kind of a direct barrier to go to work or healthcare or education or essential services. There are single mothers or people with disabilities or chronically ill individuals and residents with limited transportation options that are often trapped in places without having any transportation options. And that's why rural transit is not about convenience, it's about survival for many of those. Just to give you some background, in 2023, Sain Associates performed a statewide study in Alabama that investigated the rural public transit in the state. And the study included data collection regarding vehicle inventories or service areas, ridership, the cost, the impact, return on investment, and all those stuff. And what they found was several counties still lack rural transit services, and even in the counties where they have services, the coverage of the service was limited. So, uh, 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 and on top of that, the the fleet, transit service fleet across rural systems are kind of aging, and many vehicles might be approaching towards their useful life. So overall, significant gaps remain in service coverage, hours, reliability, vehicle accessibility, weekend services, evening services, and the fleets are aging, and the awareness amongst the riders is also limited. That's the findings from this study. So in Alabama, we have 28 transit providers that operate in 58 out of these 67 counties. These systems rely heavily on the two major, FTA funding programs. Uh, they are broadly categorized into public transit, and the other one is the human services transportation. Uh, and So if you look at on the right side, the 5311 program, it says there's a need for in order to avail this federal funding, we need the agencies needs to provide 50% local match, and for the 5310, which is the coordinated transportation services, for that there's a need for 20% local match. Now typically the local match are the funds that many states usually supply through their dedicated state transit budgets. But if you look at Alabama, I mean, although this is old data, in Alabama, unlike our neighboring states, Alabama does not provide any state funding for the public transit. And that's because there's a major structural challenge, that Alabama is constitutionally prohibited from using the gas tax revenues for any public transit systems. It has to be used only for roads and bridges. So what does that mean is, this limits the ability to invest in operations of the or fleet upgrades for the transit agencies, and also it also puts additional pressure on the local governments, like the county commissions and those stuff, like the local governments and agencies, to raise this required match. So then this is the West Alabama Region Coordinated Public Transit Plan, the recent one from 2024, and it provides a clear and compelling foundation for why new mobility solutions are urgently needed. So if you look at the map shows one of the most fundamental challenges in the West Alabama region. It shows the most vulnerable populations. So the older adults, the people with disabilities, and the households living in poverty. These are widely dispersed in this region, and many of these populations live far from those blue dots. These blue dots represent the key destinations like the clinics or workplaces or any other essential services. So, in other words, the people who need transportation the most are often the farthest away from it. So the transit plan also makes the situation very clear. The biggest barriers are lack of funding, dispersed population, and the fact that traditional for-profit or fixed transit model will never be economically feasible in this area. So, but then the plan also states that there's a need for some innovative ideas if these needs has to be met. So, considering all these challenges in this West Alabama region, we really need some innovative solutions to overcome some of these rural transit and transportation barriers. So these two projects, one is the CARES and other is Dry Smart. This is our attempt to overcome some of the transit barriers in this region. And before going forward, both these projects were funded under the CR2C2 Research and Education Exploratory Grants. And I would like to just acknowledge and thank the center for providing the support for this project. So first project, Community Assisted Rideshare Service, CARES. Uh, Now this study is focused on the 8 West Alabama rural counties. CARES is designed as a flexible, community-driven ride-share model. It's not a fully volunteer system, not neither it's a kind of a commercial system, but it's a hybrid tailor-made system specifically for the rural areas. It's a community-driven mobility model, meaning that the idea is all built from within the community rather than coming from external sources. It emphasizes the three pillars: the community driven, community participation, and community owned. So, in short, CARES is designed to be shaped, supported, and sustained by the local communities themselves. The This care system is powered by different community assets. It is intended to use the local community drivers, local vehicles such as church buses, school buses, or other vehicles that sit unused for much of the day. And instead of letting these valuable assets remain idle, CARES would create a structured way for the community to share what it already has. And by coordinating the drivers and vehicles and the community participation, we hope the CARES would transform the used local resources into some reliable mobility network. Uh, so, but uh, and then the side benefits of this is also kind of employment generation, because this is community owned and community driven initiative. It will be self-sustained, it's independent, and it's also flexible. So the main goal of this project was to evaluate whether this care system is even feasible in the rural West Alabama region. And then to support that goal, we had four key objectives. One is to identify local champions who will support these systems. We want to identify volunteers and volunteer sources who can actually drive this system. And we want to assess the willingness to share the community vehicles, because this whole concept of cares is based on using community resources. And then also assess to certain extent the insurance and liability concerns that might be involved in the system. So for this project, we adopted a mixed method survey, which was developed in Alteryx. Overall, we received 188, responses. That's just individuals. We received 41 responses from the community leaders, and we got 5 responses from the auto professionals as well. So these are some of the survey results. We asked them what are their typical travel barriers. As you can see from this, both within the community as well as while traveling outside the community. And as you can clearly see, the availability of transportation is supposed to be the biggest barrier. Following that is the affordability. So that means some services are available, but it's not affordable. And the third is appropriateness. So there are services which are being offered, but that still doesn't meet the needs of the riders to a larger extent. And then we asked them what the perceived benefits of CARES would be. And obviously, the improved access and easy access to transportation, reduced travel cost is that stands out. But what really impressed me is the involvement of, like people thinking that they would be able to involve and participate in the community events and socialize. That's one of the good outcome that we feel. Uh, and then we also asked them what the potential concerns of CARES would be. And obviously, the safety stood out and the reliability stood out. And some of the open-ended, comments that people gave us, oh, kidnapping or robbery or consistency of the program, because this is all volunteer, driven program. So consistency is one of the biggest concern. Accessibility, like especially wheelchair needs and availability of the services when actually needed. So these are some of the concerns that they raised. And then this is kind of inventory of the community resources that we generated through this project. A lot of individuals themselves want to volunteer either as a driver or volunteer for their vehicles or for other coordination efforts. And then there are like a lot of these organizations that are already exist here in this region, which can we can reach out to and seek some help. So when it comes to the leader, like about 41 in all, they also resonated at the community's concerns about limited hours of service or lack of awareness or gaps in service. But they also outlined what sustainability of cares would require. And these are some of the suggestions that they gave to sustain the cares initiative. in a long term. These are some of the agencies or organizations that can support cares. This is all based on the survey results, and based on this, we feel that there's a strong support for cares. Sustainability for cares will require partnerships, incentives for volunteers and providers. And obviously, without piloting, we cannot know how this system works or what are other challenges. So we are looking forward to pilot this system very soon here in this region. Now coming to our my second project, it's called Drive Smart, and as you can see, there are so many different partners here. There are NPOs. There's the Tuscaloosa trolley, the like urban transportation. There's a demand responsive transportation. There's NEMTs, and there's private micro transit operators as part of this project. And here, what you see is typically, and this is just a representative of some of the transportation services that are available in the West Alabama region. So as you can see, like these services operate in different counties. Also below that, you see 5311 or 5317 or 5307. So these are the different FTA formula grant programs which the services use to operate their service. So what does this mean is that each provider has different rules, different priorities, different service areas, different eligibility requirements. And as a result, what the residents in this region are see is a patchwork of systems where there are different services, but they don't connect or align with each other. So even though several agencies are offering transportation in the region, they largely operate independently, and their service areas do not always overlap, and the vehicles and dispatch systems and scheduling processes are not coordinated. So as a result of this, there are a lot of inefficiencies or duplication in services. And these are not what we are saying, but this is all actually documented in this TCRP report as well. And this report also says that when the funding becomes tight and the needs increase, the most effective way to improve transportation is through coordination and by reducing the duplication and inefficiencies in the system. And that's what we are trying to do in this project. So for this project, our main objectives are obviously we want to engage with stakeholders. You've seen those list of stakeholders already there on the slide earlier. We want to evaluate what are the operational or financial or regulatory barriers that prevent transportation providers from coordinating their services. We want to identify what technology needs would arise if we want to run this whole system as an integrated system in the whole region. We want to examine and address the inefficiencies caused by duplicative efforts and overlapping services, and also determine what local support in terms of funding or any other needs would be required from the local governments and leaders and communities as well. So this slide presents the three-level analytic hierarchical process that we are adopting for this project. We'll use this framework to evaluate the transportation priorities and preferences of both from the riders as well as the agencies who are providing the service, and to evaluate how regional coordination strategies will work for West Alabama. So what you see here at the top, the level one is what it says what matters most in general transportation service. So here we have identified four broad areas: the availability of service, affordability of service, accommodation, and acceptability. And these priorities reflect how both transit users as well as the transit service providers rank the overall importance of the key service elements. Then at the level two, this breaks those broad level priorities into detailed sub criteria that represent specific preferences of riders. So these includes preferences such as broader service coverage or extended service hours or weekend service, or assistance for booking or lower cost or shorter delays. Overall, this reflects what riders actually want in transportation service. Then at the level 3, we evaluate the coordination strategies. This includes sharing or combining trips across agencies, or do you want to use public-private partnership, or you want to use broker service for managing and coordinating trips and such. So these are the kind of candidate coordination strategies that will be evaluated by transportation or transit providers, not by the riders. Particularly, they will assess how well each of these strategies aligns with and improves the priorities and preferences, which would be identified at level 1 and 2, and based on the impacts of the sub criteria. So together, this AHP structure allows us to connect with rider preferences, what providers see as a core priorities, and how different regional strategies can best address them. It gives us a very clear, data-driven way to identify which coordination approaches will create the greatest impact for rural mobility in West Alabama. And like I said earlier, the CARES project is already done, finalized, final report submitted. The Drive Smart, it's still ongoing. The data collection is in process. So we'll hope to see some good results and good responses very soon on this project. So just to conclude, the transportation challenges in West Alabama are real, it's persistent, and also that could be attributed to the very rural nature of this region. CARES and DriveSmart highlight some of the solutions, innovative solutions, I would say, and which actually exist. Uh, uh, CARES offers a new way of thinking about mobility, and DriveSmart helps us step back and look at a kind of bigger picture by understanding the priorities and preferences of the riders as well as providers. So neither of these approaches work alone. And that's the reason you see so many partners here. We have worked with non-profits, local governments, community leaders, university, collaborators. Uh, so these models can probably help Alabama, and not only Alabama, but also similar states build more sustainable and accessible transportation system. So thank you, and I'm open to any questions if you have.
Excellent. Thank you, Abhay.
Mhm.
And what I'll do is, when we run these, typically we have both presentations. When we do these internal ones, we have two. We have both presentations run, and then we do um, the Q&A at the end. And because we are cutting edge transportation people, and one of the most exciting things about cutting edge transportation is the concept of just-in-time delivery. And the university and UTC means that some of us have teaching duties. So thanks to Greg Erdhart for making haste from wherever he was just teaching a class, and just-in-time delivery. He logged on in time for his presentation. That's again a component of the MRI one, and he's going to talk about some of his ride hailing work, modeling stuff. And I'll note in this, and you saw this in the bio and all that went out. I mean, his ride hailing work is stuff that's been getting national attention. This is CR2C2. Obviously, we're a regional UTC. But everywhere we can, and everywhere that we have the opportunity to share our work and make a national impact, that's something we certainly want to be doing. And so it's great to see Greg already making waves in that. Without further ado, then, Greg, show is yours.
Cool. Thanks, Stephen. Appreciate it. So this is modeling ride-hailing demand for any census tract of the United States using open data. This was project R15. I want to acknowledge two students who worked on this, Nico Beltran and Ramtin Sayed-Mate. Basic overview here of both some problem and some potential. So the idea here is millions of Americans cannot drive or don't have access to a car, including more than 1 million households in rural areas. Passenger vehicle services, microtransit, ride-hailing, AV services have the potential to meet the needs of these transportation individuals, but in order for that to be effective, they need to be affordable. And in order to be affordable, they need to be efficient in some way. So there's some potential, but is it going to happen on its own is kind of the question. the same time, what we see is where the places where we do have data on ride hailing, what we're doing here is drawing an analogy between ride hailing and AV passenger services, where today you go out to the cities that Waymo is operating in with driverless cars, and it's operating very much like a ride hailing service. You book it through an app, you take it place to place, and there's just no driver. So the idea is to meet these needs, you have to be available and affordable in these communities, but current data suggests that ride hailing is dominantly in urban situations. This is zip code level data in California, and you see that the number of trips in San Francisco, LA, and San Diego are orders of magnitude higher than anything you see in the rest of the state, in the rural parts of the state. Likewise, we actually have very little data on ride-hailing services. The places where we have data on actual number of trips tend to be places where it's required through regulation. So California, it's required to be reported to the California Public Utilities Commission, which is where this map comes from. New York has it to the Taxi and Limousine Commission. Massachusetts does, and Chicago does. Maybe there's a couple of others, but there's not a good national data set. And I'm not aware of any in the Southeast in terms of actually having data on actual number of trips. So in order to design this system, we actually want data on the trips, because in order to, AVs could potentially reduce the cost of labor, but you've got these other costs. And the demand is going to be a function of the cost, the travel time, the population employment. At the same time, the cost is a function not only of the labor, but of the vehicle, the fuel, the demand. In effect, if I can serve more people with the same number of vehicles, or have the vehicles filled more and have less deadheading, less operating without a vehicle, I can deliver the service more cost efficiently. So you want to know something about the demand to assess that. And yet we lack these data. So instead, what we're going to do is we're going to estimate them with a model. What we did here is we took data from Chicago, which has reported what they call TNP, Transportation Network Provider trips, at the census tract level. They're reported in 15-minute increments. You get origin census tract, destination census tract. And I had a previous PhD student for his dissertation estimate a direct ridership model of this. So it's an aggregate model for every census tract, how many trips are generated as a function of population, employment, demographics. We do a destination choice. So we estimate level of service from OpenStreetMap and GTFS and say, where are they going? We look at it, is it shared or private? And we have that as an indicator in there relative to the travel time and cost. And then if it's a shared trip, do I get matched with another shared user? And that depends on the demand as well. And that's where there's a lot of potential for cost savings, is if I can pool the trips and share across multiple users in the same vehicle, then I can start to reduce the cost for people, deliver the service more efficiently. In order for that to happen, you need a sufficient number of other people who also want to share. So that's potentially harder in a rural area because the market is smaller. So we have this existing model, and we designed it in the first place to be estimated from Chicago data, but applied entirely to open data. And so what we did in this project is we took that same model and applied it in a more generic sense. We rewrote the software in a way that made sense, and we designed it to work for any census tract in the US, actually. We've applied it in a few states in the Southeast, but you specify the name of the state that you want to run. It goes to the census APIs, pulls the relevant data files from the APIs. It goes to the LEHD data, pulls the employment data. It goes and pulls OpenStreetMap data for that state, builds zone-to-zone travel times, applies a set of models, and you end up with a list of trips or estimate of trips originating in every census tract, destined for every census tract, segmented by shared versus private, and segmented by whether those are matched. On these models, I'm not going to go through all of the details of them, But I want to point out in particular a little bit about the things that we learned in Chicago. And this is the trip generation model. This is just how many trips are coming from every census tract. And so a couple of things that you see here is airports matter a lot. Airports are a big generator of ride-hailing trips. You avoid the cost of parking. Tourist locations are also a big generator. In Chicago, this was Navy Pier, and this was the convention center. Then you have a few categories of employment. In particular, food services employment is important, as is retail employment. And these are segmented by time of day, overnight, AM peak, midday, PM peak, evening. And so you find food services, for example, people going out to dinner, going out to drinks, and so forth in the evening is a pretty important attractor. And then you have households, and we segmented households in 2 dimensions. This actually comes from the Census Transportation Planning Package. This particular cross-tabulation is not in the Americans Community Survey, which we use elsewhere, but we segmented households by both income and vehicle ownership. So we define high income as $100,000 or more, low medium income is below $100,000, and either 0 vehicles or 1 or more vehicles. What you see here is pretty interesting. What we find, and you see the high income households with 0 vehicles, the estimated coefficients are 2 orders of magnitude higher than you get, well, 1 to 2 orders magnitude higher than you get for anyone else. So the others are still significant, but the core market served here, as revealed by the data in Chicago, are 0 income households earning $100,000 or more. So you get a lot of those on the north side of Chicago. You get a lot of those in parts of New York, parts of Boston, other places. You don't actually get a lot of those in Kentucky, especially in rural Kentucky. Most of the people who don't own a vehicle in a rural area don't own a vehicle because they can't afford a vehicle, not because they make a lot of money and don't need a vehicle, live in a place where they don't need a vehicle. So if all you did was plot where these households occur, that probably gives you a pretty good estimate of where the trips are going to occur on ride hailing. And I think the same probably applies to Waymo right now as well. What we do then is we want to know, okay, this is clearly an out of sample application here. So if I want to take this data from Chicago and apply it, especially in rural areas where it looks a lot different than Chicago, how can I know if this is any good? So I look then to other places where there are ride-hailing data available, and I do a validation. And the place we did this validation is Massachusetts. So the Massachusetts Department of Public Utilities collects observed ride-hailing ridership by city. So you get Boston, you get Cambridge, you get every city and town in Massachusetts. And we actually aggregated these to the county level because the cities and the census tracts don't necessarily align, but both nest into counties. And when we did this, we just took the model as it is, we applied it, and we did a little bit of digging and we found some differences. And one of the major differences we found is that in order to apply this, we first had to code where the airports were in our Massachusetts data. And we actually have this set up in a way that you can set up, there's a FAA categorization of the size of the airport based on employments. And so we have size 1, 2, 3 airports that we did. And then the other thing we found is when we initially applied it, we were actually doing a pretty good job in the more rural Massachusetts counties or the smaller Massachusetts counties, but we're underestimating in Suffolk County, which is Boston in particular. And we hadn't included any of the tourist locations in there. And so we went through and we had to, by user judgment, add in some census zones where we set up a binary flag and we said, this is a tourist destination. We think this is important and likely a large attractor. And then we applied it that way. This is what we get when we do that application. So on the left-hand side, you have a scatter plot, observed trips on the x-axis, model trips on the y-axis. The diagonal line would be a perfect fit. The red points are without the tourism attractors. The blue points are with. And what you see is in the bottom left, the smaller counties, we're actually doing pretty well. And that's reflected as well, sort of the smaller, more rural counties are in the table on the right, in particular. And you see that even with the tourist locations, we're actually underestimating the number of trips in Middlesex and Suffolk County, which are the bigger, more urban counties. But you look at Berkshire, Bristol, we're estimating, say, Berkshire 300 trips, and there's 200 observed. Bristol 3,500 trips, and there's 4,600 observed. Hampton 4,800 trips, and there's 6,000 observed. And where we're sort of under, again, Suffolk, we're estimating 122,000. We have 188,000 observed. So this actually I found kind of remarkable that it worked so well, that you're getting some estimate that's in the right ballpark. And maybe you're off by 20, 30% or whatever it is in these smaller counties, but it at least gives you sort of a first order estimate that you can make some assumptions, because your alternative is knowing nothing in places that don't have the regulatory framework to collect these data. Okay, so once we're satisfied then that this is kind of doing what it's supposed to do, in Western Maine, right, there's parts of the Southeast that are more rural than Western Massachusetts, but Western Massachusetts is at least some analogy to lower density locations. We take it and we applied it to Kentucky. And so here's our estimate of ride-hailing trips by origin census tract in Kentucky. And let me see, I'm not sure if I can do, can I do notation? Yeah, so this is Louisville, biggest city in the state. This is Newport. This is right across the river from Cincinnati. This is Lexington. Those are the three biggest cities. And then Bowling Green is over here. And you see, kind of as we expect, that the trips are more concentrated in these urban areas, these urban census tracts, as we see kind of in Chicago and as we see in Massachusetts. So this seems plausible. We can then do a couple of things. We can add up the numbers here. So we're estimating on an average weekday in Kentucky, about 40,000 trips statewide. For reference, Kentucky is about 4 million people. Chicago is 3 million people in the city limits. Much more dense. Chicago had about 175,000 trips on an average weekday in the data. So less dense, fewer trips. That kind of makes sense. It seems basically plausible to us. Average distance, 8 miles. Average time, 16 minutes. That doesn't seem crazy. This is skewed a little bit longer than you observe in Chicago. I think for the most part, ride-hail trips that we observe tend to be pretty short. And that's because usually you're paying per mile and per minute. And so the trips get more expensive as you get longer. Average fare, about $11, based on our estimates. And we had fare data in the Chicago, so we have a model that's basically a regression of fare equals some constant plus some rate per mile plus some rate per minute. The average shared fare is a little bit higher, and that's because the shared trips are on average longer. So the fares of the same trip would be lower for a shared trip than a private trip. But sharing is more possible for longer trips. And we found here about 66% of trips were private, 28% shared and matched, and another 5% ended up shared but without some other sharing. So you get the discount, but not another passenger in the car. These were pre-COVID numbers that we estimated. Chicago, we found about 20% sharing. Post-COVID, it's down about 5%. So the sharing has really taken a dive since COVID hit, and the prices have, I think, equalized a little bit over that time. And then we find about 1.6% of trips originate in a rural census tract. So dominantly the urban areas, relatively small numbers in the rural areas. Weekday revenue here, you're looking at about $466,000. So your annual revenue, $116 million. In rural areas, you're looking at about $1.9 million. Okay, so there's a couple ways to look at this. You can look at this first as saying, well, people in rural areas aren't interested. The other way you can look at it is you can say, well, 1.9 million out of 116 million is enough that if we think it's important to provide that service in rural areas, it would be practical to charge the urban users a few percent surcharge and use that to subsidize and make the rural trips more affordable. So that's a possibility. That's something we could do because there's not a lot of trips. So then what we said is, okay, well, if we start to do that, the demand is going to change. If we end up decreasing the fares, either through some cross-subsidy scheme or through automation and reducing the costs through AVs, you could start to change the demand. And so we did this, and we found if we cut the fares in half, we'd increase the average travel time. You'd go from, before we had 41,000 trips, cutting the fares in half would go to about 60,000 trips. You increase the trips by about 50% with half the fare, make them a little bit longer, and you find here annual revenue in the rural areas around 2.2 million. And you increase the trips in rural areas up to about 1,300 on an average weekday. We can also go down to a quarter fare. And so in that case, you're up to 86,000 trips, and you're up to about 2,000 in rural areas. What you see here is that cutting the fare to a quarter is basically doubles the number of trips overall, but it more than doubles the number of rural trips. So there's a little bit of extra incentive there, and that's because the rural trips are longer, and so the price is higher. So cutting it down to a quarter is going to make that difference. We did then some work looking at the operator cost, and this relates to Project R1 that Andrew and Musa were working on. They did this with sort of healthcare shuttles, but we did something similar here of kind of, okay, depending on the hours per day, the cost of drivers, the days per week, the number of vehicles you need, what do you get out from an operator cost perspective? And you can tinker around with these numbers, and basically you find, depending on the situation, you can add up what that is or what it costs to run such a service if you were to run it yourself. So some basic initial findings here. About 98% of trips in Kentucky would be in urban areas is our estimate. Somewhere 600 to 2,000 ride-hailing trips on an average weekday, depending on how we set the price. And the cost of serving these would be on the order of $2 million annually. Statewide, about 2/3 of that cost is in the driver's wages and benefits. So you're potentially on the order of cutting the cost, if the vehicles are cost efficient, of cutting that cost substantially through automation. So that's kind of what we find overall. These are open source, open data. You can look at these on GitHub. It's implemented in Python. We do use Julia for calculating travel times between every census tract through OpenStreetMap. That's pretty computationally intensive, so there's some extra setup involved in that, but you could do it on a large scale that way. Pulls data from some general APIs, and basically you give it a parameter of I want to run it for this state, pull all the data, run it, you can get those outputs out. I'm happy to work with anyone who is interested in tinkering around with this, but the sorts of things we can do then, and the sorts of things we were playing around, Musa was playing around with in Project or MRI-1, was starting to then look into agent-based simulations of the operating fleet. So once I know where the demand is, I can start to simulate when are the pickups and where would individual vehicles need to be driving in order to do that. We did that using model called FleetPy, developed out of TU Munich. And it seemed to work pretty well. The setup was relatively straightforward. Within about 2 weeks, we could sort of get it set up working, figure out what's in there, and then you can start to do different scenarios with different fleet sizes, different levels of demand, and so forth. So I think there's some potential here for others who are working in this domain who need maybe an estimate of the demand to build off of what we have here. Let me stop there, and I think we can move to questions and I guess general discussion.
Excellent, excellent. Thank you very much, Greg. Like I said before, so what we'll do now is we'll open the floor. I'm monitoring the chat. So questions for Greg, questions for Abhay, discussions, comments, all of it are certainly welcome. You're welcome to put them in the chat, or if you want to, ask your question online, turn your camera on or off, it doesn't matter. But now's where we have the exchange and the knowledge transfer part of this. So again, thank you very much to the two speakers, and any questions here? I will ask one question to kind of get things started. First of all, Greg, I think this is super cool work, and I understand. I mean, there's a process of going from the big city stuff to Chicago, and then the rural Massachusetts and all that. And you were spot on. I totally agree. Recognizing rural Kentucky or rural Massachusetts is not like the rural South, and I don't even know that necessarily. I mean, you have Appalachia and we have the Black Belt and stuff down in the Deep South. I suppose one of the things that's interesting, right, is I mean, there's rural mass. My daughter lives in rural New Jersey, and rural New Jersey ain't like rural Alabama, right? And part of that is I mean, even from the trip generation side, the mix of land uses. I mean, I'm not here to talk about my daughter, but my daughter has a better quality of life in a small town in New Jersey than she would have in an equivalent sized town in Alabama because there's just simply less places to go and things to do, right? And I'm assuming, that would be an interesting calibration part of it, as well as, and then I'll stop talking, is again, deep Appalachia and the Black Belt that runs through, down here, extreme poverty. I mean, we're talking, well, I think we all know what we're talking about. So anyway, some thoughts there.
Yeah, I think you're absolutely right. I mean, you go to Eastern Kentucky and you're up in the mountains and up in the hollers, and it's a different ball game. The income is totally different. The level of resources is totally different. And you actually have, there's a statistic, there's, I think, over 100 counties where 10% or more, 100 rural counties in the US where 10% or more of, maybe it's more than that, where 10% or more of households don't have a car. And Kentucky and the Southeast is kind of ground zero for that. And if I'm without a car in Eastern Kentucky in the mountains, my employment prospects are terrible. Now, actually, I was talking to a lot of Nick Stamatiadis here at UK. And gosh, about 20 years ago, he did sort of a rural transit study in Eastern Kentucky. And it was sort of just finding out what people without cars do out there. Right. And a lot of it was just relying on friends and family, right? So maybe I don't have a car myself, but I'm living on a trailer on my family's land, and so I walk down and my family has one. Or I go down to my neighbors and I get a ride into town where I do that. And you start to talk to people, and right, a lot of the people who don't have it is maybe it's older women who never learned to drive, and their husband, and they've outlived their husband, sort of thing. That was a big part of it then. Maybe a little less of that now, but I think still a big thing. You have it intersecting with sort of the opioid epidemic, and people losing their licenses is an issue too. Gosh, trying to serve that with an automated vehicle, I think is tough. And I think there are a lot of cases where you do need kind of local solutions. You start to talk to people and they're like, oh, well, and they provide solutions I wouldn't have thought about. They're like, oh, well, the church has a church van and they use it to bring people to church on Sundays. Can we use that to drive people to tie into town to go to the Walmart on Saturdays. And
Absolutely.
that's the sort of thing that is like, well, gosh, sitting here and trying to solve things with technology I wouldn't have thought about, but you go out and talk to people and you get some pretty cool ideas actually. And it's like that actually makes a lot of sense. So I don't know if I answered your question or not, but I think you're absolutely right. The context is a lot different.
No, no, you did, and whether you meant to or not, that was a great sort of like you played into my hands, right? So that was totally perfect. And what you did was provide a nice bridge to what Abai was talking about. His was about community-based ride share and all that. And I'm gonna stop talking in a second because we've got another question. But to me, there's this interesting thing. Even I mean, whatever, all the stated preference and all that, because when you get into the what you're talking about, the extreme Appalachia where people are dependent on others, you add a layer of agents and agent-based modeling, or even in all the preference surveys and all that, because the travel can be one step removed from the capacity to do so, which is a super interesting problem, right? So,
Yeah.
and so at some point in time, Abai meet Greg, Greg meet Abai. You guys should talk, and there's some cool things there. Got a question here from Dave Myers, who, if you all will remember, he gave the seminar earlier on in the semester. So Dave, you've got it in the chat, but you turned your camera on, so I'll let you speak for yourself.
Yeah, I'm happy to talk since I'm here. Yeah, thanks, Stephen. And nice meeting both of you, Greg and Abhay. My question, I'm involved in a similar project, but nowhere near as deep as you guys, in rural Michigan, and in conversations with Stephen about in some way collaborating further with you guys down the road. I'm a bit more of a generalist, maybe a user, consumer-minded person. I put in the chat, of these four things, what do you think is the biggest barrier? One, federal funding, lack of service providers like Waymo, who I've worked with for a long time. They're not going to rural mobility anytime soon. They're starting big and going small. But finding a provider who would want to go invest in rural mobility systems, the municipality to pull it in, or just consumers out in rural environments, they really only want to move around if they own their own car. And so they're willing to suffer longer than they should. I'm just curious which one of those strike you as, this is the biggest thing we have to get over, and then this one and this one, from you guys being so deep into it.
Uh, well, that's a very good question. But so I think, I mean, when it comes to funding, I don't think federal funding is an issue. It's always there. I mean, it was always there and it's still here. There are service providers as well. And most of them are kind of well established. They're running the services for a long time. They have been successful. Uh, but I feel, and then you have your last point, right? Aversion to shared transportation versus only wanting to use their own car. Well, if people who have their own car, they will always prefer to drive their own car. Okay, no one is going to drive, 30 miles public transit service, uh, even if you have a car, right? Because there's a lot of dependency on, stops and time and those stuff. I think, based on my conversations with some of these service providers here around, uh, I think there are a lot of operational challenges, issues. One is obviously the workforce, shortage of drivers, and it's not like any grocery store where you can just hire someone and he starts working from day one. When you hire a driver, then he has to go through a lot of training programs and those kind of things, background checks and those stuff. So there's kind of uh, a lot of latency as well, I would say, between, so essentially the workforce is one of the biggest problem. Another thing is probably the operational challenges, vehicle maintenance and those stuff. Uh, and and I think overall, if you look at, there's a kind of chicken and egg kind of situation, wherein uh, with respect to all those limitations of these service providers, they try to do their best, but that's not enough. That's not enough from the rider's perspective. Okay. For example, some of the stories that I have heard is like there's a ride available when you don't need it, but there's when you need the ride most, that's when it's not available, right? Now that's again because of, I would say, it's kind of complex problem to describe, but I would say, um, I mean, ideally, if I would have a larger fleet and I like, let's say, a taxi service in urban area where you have, too many fleets, there's a lot of demand, and you can just access any of the taxi service anywhere. That's not the case with the rural transits. They're limited on their fleet size, they're limited on their service, they're limited on their routes. Uh, and Even if they want to expand or make it better, uh, there are not enough resources, I would say.
Absolutely, absolutely. And Abhay, I'll stop you there. I could just want to see if there's another question coming up. But you're right, Abhay. I mean the scale is a limiting thing. But I will say, and many of you here who are representing rural areas or whatever. I mean, we've had conversations here in the state of Alabama with rural transit agencies that have said, look, I mean, everybody's scared of automation taking jobs. We would really like to have automation here because we can't fund. We could put more vans on the road if we had, autonomous drivers or more drivers, and so that's an issue there. All right, so Greg, I saw that you answered that question there in the chat. Thank you for doing that. Any final parting shots or anything on that particular answer or anything on your part, Greg?
Yeah, I mean, unfortunately, the data we have from the city of Chicago doesn't collect purpose, right? You just know that there is a trip. That's all that's reported. So you can guess, but that's the best you can do. And yeah, I think all I'd say about the sort of what can we do for better rural transportation, I think it's never going to be as good as it is in a city because stuff's farther apart. And there's nothing you can do about that. I think the best you can do is say, we want to provide some basic level of service because we want people to be able to get to work, and we've got to pay for that. I don't know that there's any, like, you can make some adjustments around the edges, but at the end of the day, someone's got to pay for that if we think it's important, or we let them go without, are really your choices.
Absolutely, absolutely. And I think, and obviously understood. I mean, we work with the data sets that we have and the limitations. I think an interesting thing, and it kind of goes to Javier's question about the trip purpose and all that. I mean, obviously, and we have projects here in CR2C2 focusing on, jobs access and healthcare access. And those are the things that we can immediately get some traction with. But I mean, like, I'm from Alabama, so I can put it this way. But we're facing a stage where there's an aging population that is a big bubble that's going to hit where they cannot or should not drive. And I will speak for the state of Alabama. When we hit a critical mass where Meemaw can't get to church, we're going to see a whole new need of trip purposes and things because it's going to be true quality of day-to-day quality of life issues, not just economics and jobs access. All right, let's see. One question there that popped up. We're about at the top of the hour. Oh, one last thing, Greg. You and I need to connect offline about making sure, because we're talking about the open data set from a tech transfer standpoint. Let's make sure that we get that out on the CR2C2 website and that sort of thing, but that's offline. In India, yeah, quick question.
Yeah, thank you. I'm an India. I'm PhD student at University of Arkansas Fayetteville. Part of my dissertation is also involved with like rural transportation stuff. So I'm personally interested joining these kinds of lectures. So I have two questions. One's for Dr. Abhay and the other one's for Dr. Greg. For Dr. Abhay, I was wondering, I might have missed, but in one of the particular slides, particularly for DriveSmart project, I was wondering, like, how are you trying to address the concern of safety when it comes to public transit, especially? So do you have any plan of addressing that, or you already have it?
No, so for the Drive Smart project, no, we don't have any safety component as of now in that. It's uh, so essentially it's more like a kind of what I would say is kind of structural issue that we are trying to see handle here. So we have multiple transportation service providers, all funded through different fundings, and all of them run for different purposes, and they did serve different regions, right?
Mhm.
Uh, and and which leads to inefficiencies, a lot of uh, dead trips or empty trips. Uh, but we also know that there's a huge demand. People are like I was answering Greg, and we said, you know, people want rides, but the rides are not available for that time, right? So we just want all these different services to coordinate with each other in terms of whatever resources they have, and kind of instead of looking at these 5 or 10 different services, can we have an kind of one single integrated coordinated service region wide, which will make it more efficient and more reachable as well, or more available to the residents as well. But there's no safety component there in that.
Mhm.
Just real quickly before Greg. So first of all, and I typed this in the chat, although I'm a horrible typist and I was doing it too quickly. Everybody, thank you for attending. This is great. We will be back next year. There will be, again, we'll do through the internal and the external. One of the exciting externals we're about to have is Karen Lightman, going to talk about rural transit issues, and she's with the national UTC based at Carnegie Mellon. So look forward to that. The information coming out. If you want to stay on for a little bit and continue this discussion for the next 5 minutes or so, I'll keep it open. But otherwise, thank you everybody for attending. Have a great Thanksgiving, great weekend, great weekend, and all that. And we will see you at TRB and certainly after that. So, but anyway, I will get back to the discussion, Greg, if you want to make a few last comments, and then we'll move on.